Hi group, my Victory Friday is actually myself. My back was struggling a couple weeks ago and I just haven't had time to work on it. And again, I've got more backstory to it, but where I was at, my back's in a really good place. Again, I've got some significant disc things that we've been working on. Again, my back pain started when I was 16. And as we go into, here's everything that's happened to me throughout my lifetime. Lots of compression and sacrum into coccyx, coccyx into 5, lost my innominate extension. So again, with gait, just constant shear forces on my 4-5. So that's a whole nother story for another time. But my victory today, actually it was a couple of days ago and my back is feeling great. So my back is usually in a pretty good place. I know how to sleep well and support it. I know how to stabilize it through all of the skills that I have mastered and share with my patients as well through the core first approach of Vicky's. And I still automatically, we call it BET, but through all of that work. So I take really good care of my back because I know I need to, because I have underlying pathology and some damage that just needs extra care. But perfect storm, I picked up a virus. Viruses, for whatever phenomenon, tend to settle in our weak places. So it's interesting, again, a whole nother conversation for another time, but some patients I've had where they come in, all of a sudden their back hurts. Well, what's going on? What happened? You didn't lift anything. You didn't do anything. The trifecta is not there. Oh, you had a virus, or perhaps that vaccine kind of settled into the system. So anyway, I had picked up a virus and didn't quite put all those pieces together yet. I was about to start my period. I'm perimenopausal. So again, here's some increased pressure at the uterus. And I was in a car accident a couple weeks ago. So again, just a little bit of whiplash, but enough strain on the dura. So here's these 3 factors creating just a little increased strain on my lumbar spine, especially that L4-5, which is my weak link. So it just was a little grouchy. It wasn't disky, because it wasn't that swollen, irritable, grouchy. It just was a little pinchy. It wasn't on the nerve root, because sometimes I'll get it down the L5 nerve root all the way down, but just a little pinchy. So finally, I was able to get back in the gym, and AP, I just spent probably 15 minutes on AP. And that's, again, there's just so much amazingness to what we do in the IPA and in the brawl world. And, but one of my most favorite brilliant things, and again, always back to thank you, Greg. Thank you, Greg, for going AP, right? We are one of the very few organizations that treat the front of the spine. And that's so important. So as we look at the big picture of gait, we look at leg swings, and again, we look at these shear forces that happen. Vicky always says, right, here's this little tree branch. You bend it once, it's fine. You keep bending it. And that's often what I feel in my patients and in myself, that there's these little forces that continue on L4, L5, maybe even higher, again, depending on what they've accumulated throughout their lifetime as far as trauma and impact. So anyway, my leg swings are pretty clear. Again, they've been cleared out for a while. I don't have to work on them too much, but I still have a bit of a hypermobility at L4, L5. Throw on some inflammation. So I just sat on my back. I put my feet up. You know the position of jackknife, right? Where you get into jackknife, you hold your patient's leg up and you work your way through. So I really did. I spent probably 10, 15 minutes at the gym, and I put my feet up on something that doesn't move. I kind of slide my bum underneath there and I work my way through. And this is where it's a beautiful blend of the brawl work, knowing your anatomy, knowing the tissues that you are going to be working through to get there. So often we can't just get there. I used to bruise people. I used to come in pretty fast, pretty hard, and they would have bruises. I really, very, very rarely bruise anybody anymore, just because I've learned the finesse. I've learned how to work my way through. I know how to work with the tissues to get to where I want to be. I know my end feels really well. So again, it just comes with practice. It comes with time in developing your hands for that very, very exquisite palpation and sensitivity. So I went in there and work. I worked my way all the way down to the front of L5. So I was able to find L5. I had to work uterus off a little bit. Think about that ligamentum flavum on the front as well. Perhaps, I'm not sure if peritoneum is all the way back there, but I just got in there and worked. And not a lot of pressure. I got in there and sustained pressure. And then sometimes I would work into a little bit of legs. For me, there was a rotational piece, but again, you can feel, right? So you're on that restriction, and then I localize with the rest of my legs. pressure on, pressure off. Sometimes it was a little bit through, again, what we used to call FO2, pressure on, pressure off through the functional movement patterns. Sometimes it was actually resistance, so functional mobilization. But over that time, I was able to work that L5 back. And for me, I tend to go into an anterior shear and a left rotation of my 4, 5 comes with it. So as I work my way up to the M plate, top of 5, working that back. Again, I'm still working in flexion. I'm working that vertebrae back. I'm working the lower extremity over and around it to just help that vertebrae sit back, because again, I've got a hypermobility there. So it doesn't take much. Throw on some inflammation. Maybe I sleep just wrong and I get just that little bit of shear force. So I needed to work the vertebrae back, open up the backside, which I didn't work anything posterior. I just worked AP, but in a lot of flexion through my pelvis using the lower extremity. So, and of course, so it wasn't immediate, like immediately, yes, that felt a little bit better, but even over the next 2 to 3 days, that pinchiness wasn't there. So the power of anterior posterior mobilization and the finesse in working your way through what are the structures I need to treat out before I get there. And then how do I work that vertebrae to sit back and not be in so much of an anterior shear as we call it. And then absolutely, right, I got that hypermobility. It's a vulnerability. I jumped right into stabilization. I went into a little bit of hook line with traction to stabilize, engaging the ball of my big toe. Again, all of that comes in the CFS, our core first work. And then once I got refacilitated, I got the neuromuscular return back on, got my tonics firing again, then I was able to work a little bit of resistance through the extremities to just reinforce that. So AP, lumbar spine, is a phenomenal skill, and really critical for probably every patient with back pain. So if you haven't taken those upper level courses, keep taking your courses, and I love sharing with you.